Hello and welcome to Time of Death. I'm your host, Dee.
And I am Ris.
And tonight we will be unraveling a shocking case that really, I think I'm jumping the gun. You want to do your spiel?
Just going right for it.
I'm ready.
If you're new here, welcome. We are two nurses that love talking true crime. We like to focus on cases that have a heavy medical influence to them, or cases that feature a medical professional as a perpetrator or victim. So if you're new here, welcome. And Dee, you can start again.
So tonight we will be unraveling a shocking case that really, I think, exposes the betrayal, greed, and a systemic failure of the medical community as a whole. So some of you might be familiar with the name Dr. and I'm going to massacre this, but Javaid Perwaiz. Dr. Javaid was a Virginia OBGYN that spent decades performing unnecessary surgeries on many of his patients. But this isn't just about one bad doctor. This podcast episode is not just about him. It's also about how a hospital, Chesapeake Regional Medical Center, seemingly enabled his actions for profit, leaving hundreds of women permanently scarred, both physically and mentally. So buckle up. This case will really have you questioning who you can really trust in this healthcare system, this hellscape. Dr. Javaid began his career in the 1980s. He really was renowned as a skilled OBGYN in Virginia at that time. Patients trusted him. He was charismatic, exuded charm, confidence, and also authority. But behind the scenes, there were allegations of malpractice that were mounting. As early as 1984, he lost privileges at a local hospital due to concerns about unnecessary surgeries. Yet, he was able to continue practicing, moving on to Chesapeake Regional Medical Center, where for over 30 years, Dr. Javaid convinced women that they needed life-altering procedures like hysterectomies, sterilization, and other surgeries, often based on false diagnoses of cancer or other high-risk conditions.
Diabolical.
So, Riss, do you want to tell them what a hysterectomy is for our listeners?
So a hysterectomy is the surgical removal of the uterus, and it also might involve the removing of other organs and tissues like the fallopian tubes and ovaries as well.
Interesting. And great explanation, Riss. And sterilization would be a procedure where people would be no longer able to have children. Mm-hmm. So those are two common surgeries that Dr. Javaid would do. One victim recalled that she trusted Dr. Javaid explicitly, and when he said that she needed a hysterectomy to prevent cancer, she did it.
Well, here's the thing. A lot of the times, a typical layperson doesn't have that much medical knowledge. So when they encounter a, life-threatening situation that their doctor is saying, listen, you need to do this or you're going to die, then you trust your doctor to be looking at you, looking out for you, putting your best interests at heart. And a lot of times you can kind of put your life in somebody else's hands.
That's exactly what happened. And, her reproductive health was forever changed, forever altered. She was one of the people that found out that there was no medical basis for her having that surgery. Mm-hmm. So, not only did she have to undergo a painful surgery, but there's medical risk, right? And, I don't know what exactly her hysterectomy entails, because Riss did a great job explaining how different parts of the woman's anatomy can be removed at that time. But, it's heartbreaking. It's life-changing. Mm-hmm. Depending on how old she was, her fertility would be impacted, and if that was something that she wanted to do, she would not be able to have kids.
Exactly. And potentially a lot of the times you're thrown into an early menopause, and that wreaks havoc on your body. And when it's something that isn't actually indicated, it's like, what was the point of all this?
Money was the root for these basis of these decisions being made. So how did Chesapeake Regional Medical Center allow this to happen? So, hospitals are supposed to protect patients, but here the institution seemed to prioritize profits over people, right? So according to a recent indictment, Chesapeake Regional Medical Center received an $18.5 million Medicare and Medicaid reimbursements during Dr. Javaid's tenure, so during the time he was employed at the hospital. Staff members reported that they raised concerns about his practices multiple times, many times, but their warnings just were completely ignored by the hospital in the effort for them to be able to make money. But why would this be? Because they saw him as a money-making machine. Mm-hmm. They turned a blind eye.
And, who wants all that extra work and, the publicity that follows, a scandal like this? So better to just sweep it under the rug, is a lot of the time what these healthcare facilities think is the right route to take, unfortunately.
Well, it wasn't until 2019 that everything really began to unravel. A pharmacy technician noticed that Dr. Javaid had some really unusual prescription patterns and went on to report him. And I'm assuming this was outside the hospital. So whatever regulatory agency he reported Dr. Javaid to decided to take action. And this was the event that triggered an investigation that revealed decades of malpractice. And I think that was my other talking point. It wasn't someone administration within the hospital. It was someone who, in the spirit of advocating for their patients and trying to keep those safeguards in place, said something. So I just want to recognize that pharmacy technician for speaking, because they are a hero. I think they are a hero. Yep, they saw something and they said something. Absolutely. So the findings of this investigation were damning. Not just for Dr. Javaid, but for the hospital as a whole. Chesapeake Regional Medical Center is now facing charges of healthcare fraud and conspiracy. So the emotional and physical toll that Dr. Javaid's patients went through is immeasurable. Again, many were left sterile, unable to have children, and battling lifelong trauma. This is medical trauma. Mm-hmm. Some patients have spoken out about feeling betrayed, not just by Dr. Javaid, but the entire healthcare system as a whole, which is completely understandable.
Because how are you going to trust another healthcare worker again? You know what I mean? Like, mm-hmm. Why would you trust them? Why would you trust that? Even though, what, I'd say most healthcare professionals are trustworthy and, are trying to do the right thing, but when you are violated like that and it just turns you off to the entire thing.
Absolutely.
But I mean, it's fair. I can't imagine what they've gone through, and having then to, seek healthcare after that must be very challenging for them.
Absolutely. And I think that's when we have to recognize as healthcare professionals that a lot of our patients have been through some kind of medical trauma. Mm-hmm. And being cognizant of that, again, patient-centered care, compassionate care, empathetic viewpoint, I think that's all incredibly important. Because, like you said, Ris, why would they trust us after something like that? So it's really falls on healthcare workers to kind of pick up the slack, for lack of a better term. There's a lot of patient accounts. One patient described that she trusted Dr. Javaid implicitly, and it was really, I say the word heartbreaking, and it was heartbreaking when she learned later that her surgery was completely unnecessary. Another woman said she spent years trying to understand why she was experiencing complications, only to discover the truth during the investigation.
So did she not know that that's the procedure she had?
I believe that she was having complications later on from the surgery.
Mm-hmm.
That, again, that were never fully disclosed.
Oh, okay.
So, back in November 2020, Dr. Javaid was convicted of 52 counts of healthcare fraud and false statements in healthcare matters, and was sentenced to 59 years in prison. Which is a lot to process. However, earlier this month, January 2025, Chesapeake Regional Medical Center was indicted for its role in enabling Dr. Javaid. Prosecutors argued that the hospital ignored a wave of red flags and warnings from staff because, again, of the financial benefit that the surgeries brought. Again, authorities allege that some of the surgeries that were performed were not medically necessary, were performed without consent, and in some cases just were never performed. They also allege that he submitted false claims to Medicare, Medicaid, TRICARE, Anthem, Blue Cross Blue Shield, Humana, Centara, Optima, and so many other healthcare benefit programs.
Wow.
Quote, as alleged in the indictment, Dr. Javaid did not act alone in this conspiracy to needlessly sterilize and otherwise harm women. The grand jury found today that CRMC, aka Chesapeake Regional Medical Center, was complicit in this horrifying scheme to place profits over patient care, said Jessica D. Aber, U.S. Attorney for the Eastern District of Virginia. So again, this raises critical questions. How accountable are hospitals for the actions of their doctors? What systems should be in place to prevent such abuse? And these are questions that I think really do need to be explored in depth. So, first of all, what can we learn from this case? I think this just really highlights the need for patient advocacy. Ris did a great job bringing up that a lot of laymen, even the language used in healthcare is confusing. We use a lot of Greek. We use a lot of Latin. We use phrases that most people have never heard. Even when we're talking about body orientation, we use all kinds of terms like dorsal, posterior. They might not know what the hell. We don't even know what direction we're going in, never mind what we're talking about. So always ask questions, seek second opinions, and trust your instincts.
I'm glad you brought that up, Dee, because I've had patients who, the doctor will pop in and see them and then leave, and they say, oh, they were talking so fast, I didn't really understand what they were saying. And then I kind of, and this is for nurses and other healthcare professionals too, it is to always advocate for your patients. And I've sent doctors back in the room to explain things again in a level that they'll understand, because people, they're receiving news, they're overwhelmed, and they really need to be explained things in a way that they can understand. And it's our job to make sure that they're getting what we're telling them.
And if something does not feel right, speak up.
Yeah.
Advocating for yourself is important. I always tell patients that advocate. Second, I think this really underscores that there is a need for systemic reform in the healthcare system. Hospitals must, not should or need to, they must prioritize patient safety over profits. It's a need.
Yeah, it's out of the question. It's what year? 2018?
Huh?
When did these crimes happen? They've been happening since
They've been
1980s?
They've been happening. He was with Chesapeake for quite some time, but he had some misconduct on his license previously.
When was he caught, though?
He was caught in 2020.
So it's especially, we have cases where, kind of similar cases where there were a lot of red flags and they were swept under the rug. And now in the, 20 teens, 2020s, now in today's days and age. Now in today's day and age.
Sounds so
old.
There's
no excuse for this. No, there's no excuse.
I absolutely agree. And, we have to recognize that trust has been broken and the consequences of that are devastating. Also, I think, there needs to be stronger protections for people who are whistleblowers within the organization as well. And they need to be able to report any type of misconduct without fear of being retaliated against.
Yes, patient safety is top priority.
And, from 2010 to 2019, Dr. Javaid made this organization over $18.5 million.
Wow.
He was a revenue-generating machine. So, again, this case is just a chilling reminder that, healthcare professionals need to be aware that trust is earned. It's not something that's just given willy-nilly. Again, recognizing that I think is incredibly important, especially in light of the blatant violations of that trust. If anyone's interested, I'm going to include the indictment itself, which I thought was interesting. Again, it just talks about the charges, the benefit programs that were involved, what the allegations were, including the legal framework based on the violations of the, it has the bunch of legalese that I don't know how to decipher, but it's all on there. But that's all I got for tonight. That's all I got.
That was a really good case, and I think it's always a good time to prioritize patient safety and advocate for our patients. And I'm glad you shared this case because it's a very shady thing that happened, and unfortunately stuff like this does happen, and there are evil people who do stuff like this, but there shouldn't be. So
thank you, Ris, for the compliment.
Of course.
All right, on that note, let's call it. I'm tired and we need to go to bed.
Okay, the time is 21:12.
Wow. What is it called? An inverse, whatever, when it flips.
Oh,
forwards and backwards.
Anagram?
Anagram, I thought, was when you mixed them all up. It's like, boob. Boob is the same frontwards and backwards.
Palindrome.
Palindrome. Palindrome.
21:12. That is 9:12 p.m. for those of you who do not use military time. We are checking out. We'll see you next week.